Hello guys, good afternoon. Welcome back to my YouTube channel. This is Professor Henderson. Today I am coming your way with some nurse educator test questions. So these questions are designed to help nurse educators to pass the CNE exam, the Certified Nursing Educator exam. So I hope these questions can provide you some insight into the nurse educator exam. So these questions were retrieved and actually pulled from the Certified Nurse Educator Review textbook or the National Leg of Nursing Educator CNE exam book. So again, if you're new to my channel, I'm Miss Henderson. I am a registered nurse. I have a master's in nursing education, and I provide educational material for students to help them pass their exams. So if you're new to my channel, please consider smashing that subscribe button and please drop your comments and give me a thumbs up. So let's look at the question. So question number 1. Which strategy will the nurse educator use to teach a group of adult learners? A. Develop learning experiences that build on previous experiences and learning. B. Provide highly structured learning activities that limit individualization of learning. C. Avoid the use of teaching strategies that foster reflective practice. D. Minimize learner participation when identifying individual learning needs. So the correct answer, take a moment and think about it. The correct answer for this question is to develop learning experiences that build on previous experiences and learning. So nursing educator use a variety of teaching methodology and develop learning that foster previous learning experiences, because people learn from their experiences in life. Experience is the best teacher. So A will be the correct answer for this question. Let's look at question number 2. The nursing faculty expects students in a pathophysiology course to correlate physiological changes experienced by the patients with complex medical problems to their clinical status. Which strategy will the educator choose to best facilitate analysis? Algorithm, clinical simulation, concept simulation, 1-minute paper. So the correct answer for this question will be C, concept simulation. That's the correct answer. Question number 3. A fourth-year baccalaureate nursing student is having difficulty inserting an intravenous catheters and is not demonstrating aseptic technique. This skill was taught in a previous course. What action will the instructor initiate to best rectify the situation? So A, fails a student in the course for not mastering the skill. B, assign a short paper on how to maintain aseptic technique. C, refer the student to the nursing lab instructor for coaching and practice. D, have the student reflect on strategy and weaknesses in the clinical area in the weekly journal. So guys, take a moment and think about this question. What you think might be the correct answer. It's not a difficult question. Take a moment and think about it. This is question number 3. So the correct answer will be C. If the student was taught this procedure and they forgot it, refer the student to the nursing lab for coaching and mentoring. Question number 4. A nurse educator is attempting to address various learning styles when delivering didactic content. Which approach will best facilitate this endeavor? This is question number 4. A. Develop at least one classroom activity that meets the needs for each representative learning style. B. Assign a group classroom activities for which each group is composed of students with different learning styles. C. Communicate to students that completion of the classroom activity will provide necessary tools for success. D. Provide classroom activity that encourage faculty-student interaction. So the correct answer is D for this question, number 4. Question number 5. Let's look at question number 5. Which student learning outcomes best represents the affective domain for learning? The student will develop basic plans of care utilizing the nursing process for patients with common alteration in health status. B. Conduct an initial physical assessment. C. Respond to aspects of sociocultural influences that impact the health of family. D. Identify and apply relevant principles of pathophysiology. So the correct answer for this question is C, is to respond to aspects of social cultural influence. So remember, the domain of learning, the affective domain of learning, has to do with your feelings, how you feel about what you're learning. You might have thoughts about how you feel about what you're learning. Not everybody feels a certain way. Question number 6. Which strategy would be most beneficial to facilitate learning for ESL students? Provide individual tutoring sessions. B. Required ESL students to take additional English classes. Require ESL students to complete assignment both in writing and orally. Organize team-based learning strategies that partner ESL and native English speakers. So this is the correct answer, D. Question number 7. To meet the needs of students who have preference for kinesthetic learning, an instructor should employ which strategy? Allow taping of lectures. B. Provide hands-on activity during class. C. Provide handouts that require students to fill in and take notes. D. Incorporate short periods of quiet time for reading during class. So the correct answer for this question will be B. Provide hands-on activity that will foster kinesthetic learning, because kinesthetic learning has to do with practicals. Question number 8. The instructor who draws on experiential learning theory would use which principles in course planning? So how students go about learning requires much attention as what they are learning. Students need to share common experiences to form a sense of community. Students will need to shed their understanding to previous life experiences. New modes of learning will be required. So the correct answer for this question will be A. How students go about learning. That's the correct answer for this question. Question number 9. Which is the primary reason for ensuring appropriate student behavior and ethical comportment in addressing the nursing program of study? So think about this one. Maintain control of the classroom, preserve the image of the profession, facilitate learning, ensure patient safety. So the correct answer for this question is D, ensuring patient safety. Let's look at question number 10. Which implication is true regarding the American with Disability Act? The faculty member is responsible for identifying a student's disability and provide accommodation. Student with disability must be able to perform the essential functions of the nursing student role. A school must expand on all efforts to ensure accommodations are provided. Evaluation of students with disabilities is performed using different sets of criteria from other students. So the correct answer is B, student with disability. They are required to function the same way as a regular student in the nursing programs. The only thing is that they provide extra time in the classroom. If they have to take an exam, they will probably accommodate them with extra time, but they are required to meet the same standards as a regular student. So guys, this is it for this video. I hope you enjoyed this video, and I hope these questions deepen your understanding and help you prepare you to take the certified nursing educator exam. So if you like these types of videos and these types of content, please consider smashing that subscribe button and smash that thumbs up and drop your comments below. Let me know what other videos you would like me to provide you. And thanks for watching. I'll catch you in the other video. Bye for now.